Drugs used for diuresis. So this is coming from the Farm Book, chapter 28. So let's start with drug therapy with diuretics. So the action, what do these diuretics do? Well, the thiazides and loop diuretics act differently on the kidney tubules to inhibit the reabsorption of sodium and chloride from the lumen of the tubule. Spironolactone inhibits tubular reabsorption of sodium by inhibiting aldosterone, which is a hormone that induces reabsorption of sodium in the distal tubule. So what are diuretics used for? They're used primarily for heart failure and hypertension, to relieve symptoms associated with pulmonary congestion and edema. So the book talks about 4 different diuretics, such as mannitol, which is going to relieve cerebral edema. Acetazolamide is going to reduce intraocular pressure of glaucoma. Spironolactone is going to reduce ascites associated with liver disease. And furosemide is going to treat hypercalcemia. So the book talks about your assessment, and when a patient is taking these diuretics, you want to assess them for dehydration, so such as your capillary refill, and if they have like a weak pedal pulse. You're checking for skin turgor. It should be less than 3 seconds. Oral mucous membranes, if they are dehydrated, they're going to appear dull and sticky. Laboratory changes such as the BUN and electrolytes. Overhydration, which can be present with crackles or vein distension. Edema, you can assess for pitting edema. Electrolyte imbalance, you want to check their level of consciousness. With hypokalemia, that means they don't have enough potassium, and the lab value would be less than 3.5. With hyperkalemia, they have too much potassium, and it would be greater than 5.5. With hyponatremia, that's their salt, it will be less than 135, and with hypernatremia, it will be over 145. So you want to assess the INO, and the output should be 1,200 to 1,500 milliliters per day. You want to assess their nutrition. So for those taking loop and thiazide diuretics, you want to increase the potassium. And you want to assess their renal diagnostics such as BUN, serum creatinine, creatinine clearance, the serum osmolatides, and the urine osmolatides. So your medication considerations. So diuretics should be taken in the morning to avoid nocturia. You want to assist the patient with developing ways to remember to take the medication, so you can set up a calendar or something for them to write it down. You want to instruct the patient to perform daily weights using the same scale in similar clothing and at the same time daily, usually before breakfast. Okay, you want to record and report significant weight changes. Usually a gain of 2 pounds in 2 days should be reported. Potassium supplements may be prescribed with diuretics other than the potassium sparing. And that diuretic therapy, usually it induces postural hypotension. So teach the patient to rise slowly from supine to sitting so that you can avoid that orthostatic hypotension. So that is the drugs for diuresis.